Hello everyone, and thank you for attending this presentation today. I know your days are busy, and I'll try to keep this as brief as possible. Today we're going to talk about the importance of obtaining a vancomycin trough in a timely manner. And I'm going to try to do this presentation without my dogs barking and the lawnmower going crazy across the street. Some of the objectives we're going to discuss today is what is vancomycin, how to manage vancomycin, what labs do we need when we have a vancomycin patient, and the repercussions of untimely vancomycin troughs. And following this, we're going to do a demonstration of drawing a vancomycin trough level via a PICC line, and Justin is going to help me with this today. So what is vancomycin? Well, it's an antibiotic. It's generally used to treat gram-positive bacteria, and it can be given both IV and PO. When we give it IV, we're looking to treat MRSA, osteomyelitis. Sometimes those patients are 6 to 8 weeks out of therapy, pneumonia, sepsis, endocarditis, and some skin infections. And if it's given PO, generally it's to treat C. diff. So let's talk about vancomycin dosing. As I said earlier, we can give it IV and PO. IM is not recommended. I would imagine it would probably hurt. Some common IV dosing in adults is 500 milligrams every 6 hours, 1 gram every 12 hours, and we know in home care we can see things every 24 hours, and then sometimes we've even seen dosing every 36 hours. Those are tricky. Some common side effects of vancomycin. Obviously, we don't want to see anaphylaxis. Your patient would present as wheezing, low blood pressure. It's important to obtain vital signs previous to giving vancomycin. Maybe a little indigestion, hives, or itching. We want to teach the patient to report any of these symptoms, obviously, but also any ringing of their ears or an unsteady gait or any urinary changes. That could be related to ototoxicity, neurotoxicity, and nephrotoxicity. I always tell my patients just to report anything that doesn't seem right. Another side effect that you would see from vancomycin, it's called red man syndrome. This is commonly caused by too rapid of an infusion. What happens is the patient literally from nipple line up, they get red to their face, neck, upper torso, and chest. They may have some weakness, angioedema, and/or chest or back pain. And these patients will pre-medicate, and generally with Benadryl and Tylenol. The doctor may throw in another medicine, but generally it's Benadryl and Tylenol. And we can usually back up the infusion or slow the infusion down. But once a patient has red man syndrome, they will develop it again as they are placed back on vancomycin. Let's talk about some of the players that are involved with vancomycin management. Obviously, the patient and or the patient's family, who's ever managing the vancomycin, the ordering physician and or a primary physician. Sometimes a patient, an ortho may order vancomycin, but perhaps the primary MD is following the patient. Also, the IV pharmacist, they are your friend, and their staff, and most importantly, you, the nurse. Some of the lab work that you would see for a vancomycin, you're going to see a CMP, which is a comprehensive metabolic panel. Some people do a BMP, some physicians. But mostly they want to really look at that bun in creatinine. That really tells them how their kidneys are doing. You might see a SED rate, you might see a CBC, and you might see a PICC and trough. So vancomycin PICC, I just want to talk a little bit about it. It's obtained immediately after the IV dose is finished infusing. So say they infuse at 8 in the morning, it runs for an hour. You'd want to grab that PICC at 9 o'clock. PICCs are not used as much, but you still may hear it or see it. So I just wanted to talk briefly about it. And some physicians say that it is not recommended. So vancomycin trough, I think about this, I think timing is everything. Troughs are to be obtained prior to the dosing. So if they dose at 8 a.m. in the morning, a trough needs to be 30 minutes or less. So starting at 7:30 to 8, you've got to get that trough. Usually an initial trough is done prior to the 4th dose of dosing if it's like Q12 hours, and prior to the 5th dose if the patient's dosing Q8 hours. Generally at home we see them 12 to 24. So knowing what time the patient is dosing is crucial to what time you're going to be out there. If they're dosing every 24 hours and it's 12 o'clock, we know we have to get that trough between 11:30 and 12. Timing again is crucial. So as I just said, timing is everything. You need to coordinate your timing with the patient to obtain their Vanco trough. You want to arrive prior to the patient dosing, immediately prior or within 30 minutes. And there'll be a demonstration on how to draw a Vanco trough at the end of this PowerPoint. So we talk about the Vancomycin trough. What happens to it after we drop it off? Well, the results of the Vancomycin trough, they go to the physician that is ordering the vancomycin, they go to the IV pharmacist, and they come to the VNA for you to follow up on. And depending upon those results, changes in dosing may be needed to be made. And what happens if the Vancomycin trough was drawn at the wrong time? Let's talk about that. So if the Vancomycin trough was drawn at the wrong time, this affects all those players we just talked about: the physician, the IV pharmacist, you, and the patient. Physicians, what happen is the physician will give an order based on the Vancomycin trough result. The IV pharmacist will create any new doses or change in dose, and then the IV company delivers the new dose to the patient. And then the patient is instructed on how to manage that new dosing. So what are the repercussions of obtaining the Vancomycin trough at the wrong time or an untimely manner? Well, the physician, he's going to give orders that were based on the trough results that he or she got, and those results could be wrong. The IV pharmacist, what happens is it's the cost of compounding the patient's vancomycin and delivering to the patient. That's all a cost. So as far as the patient goes, if your vancomycin trough level is obtained in an untimely manner, it could affect your patient, causing them a delay in their treatment plan, which we wouldn't want to do, or even a change in their treatment plan. It can absolutely increase their risk for auto, neuro, and nephrotoxicity, as we talked about earlier. It also puts your patient at risk for a central line blood infection due to prolonging the central line in your patient. So let's talk about you, the nurse. How does the results of obtaining an untimely vancomycin trough affect you? How does it affect your relationship with your patient? Does it decrease your credibility or your trusting relationship with the patient? How does it affect your relationship with the physician? And how does it affect the relationship with the IV pharmacist? There it goes. There goes the nose. Assuming now the lawnmower went by. Okay. So again, how does this affect your relationship with the IV pharmacist and the pharmacy staff? And how, something that we really don't think about, but how does it affect the relationship of the agency? So now I'm going to demonstrate how to draw a Vanco trough level from a PICC line, and with the help of Justin. So here we go.
I'll have it just start.
Well, hi, Mr. Justin. How are you today?
Pretty good.
Good. Can you please verify your name and date of birth?
Justin Lammers, 11/27/1987.
Great. So today what we're going to do is draw your Vanco trough, and I understand that you're due to dose yourself in about 20 minutes, half hour?
Yeah.
Okay,
Yeah.
good. So what we want to do first is gather up our supplies, and I'm going to go ahead and start.
Okay.
So first thing I want to do is gel my hands. Okay. I've laid out my supplies, and for the sake of home care, we're always pretending, and we're going to pretend that this is a 10 cc normal saline filled syringe, okay? And you're going to need an empty 10 cc syringe. You're going to need a blood transfer device. You're going to need whatever tubes that you need to collect. This one is a Vanco trough and CBC, and alcohol pads, and a new cap. After you draw the blood, you'll have to change the cap. All right. Are you afraid at all?
Just haven't had this done a whole lot before.
Yeah.
Anytime someone talks about blood, it makes me nervous.
Okay. I don't blame you. Makes me a little nervous too. Okay. Then I'm going to just have you relax your arm this way. So what we're going to do is we're going to clean. And we want to clean for 15 seconds. We sing in home care, happy birthday to me twice. Okay. Time lapse. Okay. And then what we're going to do is take our 10 cc normal saline filled syringe, and we're going to go onto your line, and you're going to flush. Great. Oh, your line flushes beautiful. And then we're going to draw back our waste. Okay. So about 5 or 6 waste. This would now go into your red biohazard waste bin. Then we will come up and we will clean the line again. Another happy birthday to me twice. All right. All right, time lapse. And then we are going to take your clean 10 cc syringe. And we will add this right onto your line. And what I like to do is just kind of figure out your CBC. Usually this is about 3 or 4 cc's is needed. And this is a big one tube, and this is about 8 cc's that's needed. So we're just going to say, for the sake of argument, let's just say it's 10 altogether. So I want to make sure that I am drawing back 10. Here we go. So we're going to draw back 10 of the, and then we're going to drawing back 10 of the blood. Okay. And we're now going to put on your blood transfer device. And we're going to put in your CBC tube, and it will fill your tube. And then your next tube we will put in, and it will fill your next tube. This goes biohazard bin. Then we're going to come over to your line, and we're going to take our, pretend this is a 10 cc filled normal saline syringe. And we will once again clean your line. Happy birthday to me twice. Okay. And then we will flush your line with your saline. Push, pause, push, pause, push, pause, push, pause. When we are done with this, I wanted to, oh, I'm sorry, I want to change the cap out. So let's just say this is a 10 cc syringe, normal saline, and we will put on your new cap. We'll come up to your old cap, clamp your line, remove your old cap. Not sure this one removes because it's one piece. And we would put on your new, let's just say this is your new cap here. And
cap. Okay, and flush. All right? Okay. That's it.
That's good.
That's it, Mr. Justin. I'm going to label your tubes and take these off to the lab for you.
Awesome.
All right.
Thank you.
Thank you.
I just want to follow up with a wrap-up of what we discussed today. We talked about what is vancomycin, how to manage vancomycin, and the labs associated with vancomycin. We talked about the repercussions of what happens when we don't obtain that Vanco trough in a timely manner. And we also did a demonstration of how to draw a vancomycin trough level via a PICC line. Thank you for joining this presentation today, and thank you for filling out the evaluation forms and questionnaires. I do appreciate you all, and I miss you.